Hey guys, so I'm here at Arviv Aesthetics with Dr. Tali Arviv, and today we're gonna try Bellafill. This area, my acne scars, this area in here bother me a lot. So I do microneedling treatments, stuff like that. So now I'm gonna try Bellafill and we'll see how it works.
So we are going to do some Bellafill today. And basically what we do is it's FDA approved for acne scars. It's a 5-year filler, but it really never goes away. But you do age and things change, so we just say the results are gonna last about 5 years. And what we do to evaluate the patient to see if she's a good candidate for the acne scar treatment is we actually come here and we just stretch the skin a little bit. And if the appearance of the scars improves, you see a little bit of scarring. If I stretch the skin, if the appearance improves and they flatten out and look smoother, same thing here. Look at that. See how it looks a little bit smoother. Not all of them. Some of them are a little deeper and you're going to need to do skin resurfacing. But if it looks smoother when it's stretched out and the skin, then you can definitely do Bellafill and you'll have really good results. You do need to get a skin test for this procedure. As of right now, they might change that. It's also recommended before doing these procedures to do procedures like CO2 or microneedling or any type of skin resurfacing treatment, because what that does is the base of these scars is kind of tacked down, and so by doing those treatments you're breaking up some of those adhesions under the skin, and then when we go in to treat those scars we have easier access to that area. You know, if you're planning on doing a Bellafill, we're gonna make you do some type of microneedling or CO2 treatment prior, which this patient has done it all already. Go in. It's a pretty superficial injections, but you see how I can move freely under her scars because she has been keeping up with her treatments. So we're just gonna put a little bit of product in there. Now you do see some instant result just from the volume that the product is creating, stretching the skin, and probably just a tiny bit of swelling, but you're not gonna see like the full effect. Some nerves and vessels kind of deeper down, so they're a little sensitive. So we're gonna that. So I might do a couple more drops here and see if I can get back here. Okay. You can start to see it smoothing out a bit. You see how I'm right under this little scar, so I'm just gonna thread a little bit of product under here. And then just under this little area just below there. See why you have to do those treatments, because if not, it's pretty hard to get in under those scars. And sometimes even after those treatments, I'm using a cannula, but you might end up having to use a needle because you just can't get under there. But you could already see that scar is just a little bit more stretched out. And then your body's going to break down the bovine collagen and use those PMMA particles to create basically a little scaffold, and then your body will build its own collagen around it and make the texture of the skin look better. When you stretch it out, look how nice and smooth this little texture irregularity here. So let's try to help her build some collagen. You might need to come in for more than one treatment, obviously. I also don't want to like load up a bunch of product in there, so we're starting with one syringe because her scars are really limited to a small area. I'll put a little drop.
And then just thread around it.
Because technically you can't bolus with this product, right? So you really got to do almost like a micro droplet if you're going to spot treat, so to speak. This is not like a filler. So when you touch it, it's like butter, like it's not moldable really. It's just minimum molding, but you could see the skin's a little more stretched, so we're hoping that she'll get more of that appearance once it all settles. I'm gonna try to get a little down here
to even her out.
We're just gonna have to wait to see her in about 4 to 6 weeks and see how her skin looks. But realistically, sometimes you could even wait 8 weeks because your skin will continue to improve over a few months. generally speaking, stimulating collagen, you get kind of a buildup of collagen over the first like 4 months. And then it kind of plateaus for another 2 months, but you still get maybe a little bit up to 6 months of collagen production. And then you kind of say, okay, this is my final result. So
Okay.
we'll see how that goes. It's not meant to look even volume wise. You can add more volume on one side to correct the acne scars, and it might look a little fuller, but don't chase the volume. You're gonna have a little swelling. Later on, if there is more of a volume correction, then you can keep correcting, but this is probably more of a swelling effect than a true volume change.
Okay.
I think when come back.
Yeah, usually kind of just all.
See how you respond to it. Kind of go. This is a
Kinda
normal
cohesive.
reaction to look a little bit red like this after, could give you some ice, but it usually goes away within maybe an hour or two, and then you look normal again, and actually gonna look great with the swelling for a couple days, and then see how that changes over the next month. And come back for another treatment.
Thank you.
Okay. Fun.